Good morning. I'm Brandon Scott-Omenka. I'm the CEO of Carers Trust Solihull. This is our discussion on long COVID and what its impact may be for carers. I'm just going to allow my colleagues to introduce themselves.
Good
Lynn?
morning. Good morning. My name's Lynn Hewitt and I work with Carers Trust Solihull as Health Engagement Officer.
Charlotte?
Hello, I'm Charlotte Wade and I'm one of the clinicians with the Post-COVID Syndrome Service.
Thank you. So I'm going to start with the first question. Charlotte, can you explain to carers what long COVID syndrome is and whom it might affect?
Yep, so long COVID, it's a group of ongoing symptoms that somebody would experience following a COVID-19 infection that cannot be explained through other medical investigations. These symptoms can include fatigue, breathlessness, cognitive difficulties, so things like brain fog, memory problems, muscle and joint pain, mental health difficulties, and lots more as well. You know, it tends to impact people differently, you know, as per each person. And of course, previous medical conditions could play a part as well, because COVID can cause kind of an exacerbation of those symptoms. So it's important to notice if, you know, there's any increase or severity in symptoms, to, you know, pay attention to that as well. The symptoms vary in severity, they vary in duration from individual to individual, and they can affect anybody regardless of the health prior to the infection as well.
Thank you. Lynn?
Thank you, Charlotte. There's a lot of information that you've just given there about long COVID. So that's great, thank you. If you were saying to carers, you know, what to look out for in order to recognise long COVID in themselves or the people they care for, what would be the things that you would particularly say to look out for?
So specific to long COVID, I would say look out for the timelines of after the infection. So if around 12 weeks have passed and you're still noticing that you're experiencing symptoms, then, you know, of course, go to your GP and discuss it with them. As you would any change in health or noticing new symptoms, it's always good to just get yourself checked out.
Thank you, Brandon.
Thank you. I had a friend who had COVID really badly and was on the verge of hospital, but came through it. But then she had a succession of really quite difficult symptoms. She had long COVID. And I met someone recently who had long COVID as well. And it is very, when you've got it, it's quite, I think it's quite clear if you know what its symptoms are. The exhaustion, it stood out very much. And this friend of mine actually had swallowing problems. So she couldn't eat solids. And she was losing dramatically weight as well. And these symptoms would come in really quite intense, take her out of work. And she was so exhausted. So why we're exploring this is if there's a carer for someone who's got these symptoms, or if a carer is suffering from them, if they contact us, we can get them support, and also we can make referrals to your team, Charlotte. What should carers do if they feel they or the person they care for are affected by long COVID?
I think the first port of call is always going to be the GP. You know, it's important that these symptoms are investigated, you know, as clinically indicated as appropriate. And of course, then the GP will advise the best course of action from there. If they do feel it's possibly post-COVID related because, you know, blood tests have come back normal, chest x-rays are clear and things, then they may choose to, you know, refer through to our service. But as I said earlier, I think because there's no specific test, you know, for post-COVID, it is a little bit of process of elimination. So, you know, ruling out other health conditions, making sure that nothing's being missed before we start working on that diagnosis. So yeah, GP, definitely.
Okay, thank you. It's a good thing that there is a clinic specifically for long COVID. Charlotte, can you tell us a bit about what does the clinic do and how does it help the patients that it's supporting?
So we provide what we refer to as a holistic assessment and treatment approach. That means that we look at the person as a whole rather than their individual symptoms. We take into account, their daily routines. Are they a carer? Are they a parent? Are they working? We'd look at what's important to them, what do they want to focus on, and what they'd like to achieve from the service as well. We then support through signposting to the services that we feel best appropriate, best suited. We'd equip them with the tools they need to try and function with these symptoms, because we can't necessarily do anything to remove them or take them away. So it's important that people kind of are supported to live with them as well. And of course, strategies to try and reduce the impact that these symptoms are having. I think lots of people gain quite a lot just from having somebody that can listen and understand, because post-COVID syndrome is so complex. It can cause such a wide variety of symptoms. And of course, time, as with everybody, is limited. So just having somebody that can sit and listen and, as I said, understand is really, really helpful. And, the feedback that we get kind of indicates that, people do get a lot of benefit from the service, which of course is good for us and them.
Thank you, and that's why we're working together in order to provide as much support for carers where this may be a new experience of caring for them, a completely different thing to what we've experienced before.
Yeah.
So thank you for that. Thank you, Brandon.
The key thing as well for anyone who's watching this film is if you may be going, oh, I know somebody who's going through that, who may not even be a carer or may not be in need of our support, but might be worth encouraging them to go to the GP and explore this, because sometimes I think it can be confused with other conditions as well. Absolutely. I think the next question we had, and you may feel like you've covered this, but was what ongoing support does the clinic suggest or recommend?
So, as I mentioned, we would refer appropriately to, the relevant services. So, for an example, if somebody had breathing difficulties and we felt a referral to, respiratory was appropriate, then of course respiratory would kind of manage that side going forward. But of course, people go through these services and get told, there's nothing we can find that's wrong. So of course, we're back to kind of our level of support again. So I think one element of the service that's important is the ongoing support that we provide. That consists of frequent follow-ups with the people we're working with. How frequent they are will vary dependent on, need and what we think is best, and of course what's best for them as well. And during these appointments, we kind of generally have a catch up, see how they're getting on, see what they've tried, what's worked, what hasn't, and of course, further advice and support from there as required. Duration can vary. We tend to support people for as long as they're either, experiencing these symptoms or as long as it's taken to equip them with everything they need to kind of, live with them. So it does vary.
Thank you.
Thank you, Charlotte. Charlotte, can I ask what challenges may carers experience when they're caring for a person with long COVID?
So, the symptoms of long COVID really can have a severe impact on a person's, function. It means they can no longer do the things that they used to do before. And that's not always easy to accept, as with other health conditions as well. The fact that, it's very difficult to place a timeline on how long these symptoms will last also makes it very hard for people to accept as well. Hard to plan their lives and things. So I think, it's just about that general support, isn't it? It's about, giving a helping hand where you can, and of course where the person wants that. And the psychological support as well. These symptoms are invisible, people can't see them. And often people say that they don't feel that friends and family really understand what they're going through. So, as with anything, learn a little bit about it. You don't have to be an expert, but just try to get a little bit of an understanding, because that's going to help to support that person better as well.
Is there any way that you would direct people to find out more about it, that you'd recommend they use and approach?
Yeah, so you've got the Your COVID Recovery website. That's full of lots of information about, symptoms and what that can look like, and things that they can try self-management strategies and things on there as well. And of course, evidence and things is constantly emerging. COVID is so new, and depending on how much depth they wanted to go into, Google and search engines are full of different kind of studies and things like that as well.
Okay, thank you. Brandon?
The last question, maybe one we ought to answer ourselves, but how can Carers Trust best help? If you want to start, Charlotte, and then perhaps me and Lynn may come in on that as well. What do you think we could do for your patients if they're carers and they live in our catchment area? Or the caring for someone who's got it, yeah.
Yeah, sorry. I think raising awareness, is key. So many people come through to our service that had their infection in 2020, right at the start of the pandemic, and they've been living with these debilitating symptoms, for 3 years now, and you can't even imagine the impact it's had, and they've been doing it on their own. Not a lot of medical research out there. So yeah, that raising awareness, if you suspected, as I said, if it's 12 weeks past the infection and you're still having difficulties, go and see the GP and get the support and the ball rolling with that.
Okay. I would say as well, if a carer is caring for someone with long COVID, or they themselves have long COVID, and they're not registered with us, registration is a process whereby we talk with them about what their needs are as a carer and what support they may require, and share with them the things that we can do. Anything from an assessment and a support plan. Sometimes we can support people with accessing social care support sometimes, and they need to get breaks and respite. We do our own micro respite activity as well, some trips, and also we can assist sometimes where there's a challenge for caring, so for making an arrangement for their care, or joining a group and getting some advice and support, and just being someone at the end of the telephone line. And it can be quite transformative, some of the things that we can do for carers, because it breaks them out of isolation and exhaustion. And if they are caring for someone who's got long COVID, it may completely change their lives, and in very abrupt change, and one where they're not aware these support services are out there for them. So if they're unpaid and they're caring for someone, usually a family member, but it can be a neighbour of whatever age, and they've got caring needs, they can come to us anyway. But if they themselves have got long COVID, or they're caring for someone with long COVID, we are aware of the condition. We will support them in the way you've suggested. We will make referrals and encourage them to go to their GP and make referrals. And that's and we're very keen to look at this area. I think there's some skepticism as well. I pick it up when I'm on social media and the rest of it, about whether long COVID actually exists or if it's just something in people's heads. I've actually met at least 2 people who clearly have a serious problem. Usually exhaustion is one of the key things I've spotted, and they can describe their symptoms and they can link it to a period when they had COVID, and they had COVID rather badly. So there's no skepticism at Carers Trust Solihull about long COVID, and we want to try and reach out to carers who may have it. Lynn, is there anything you would like to add?
I think just to add that going forward, we're very pleased to be working with Charlotte and the team, and we'll be continuing to do that and seeing what we can do for your patients and carers. And I think communication between us will help us to reach more people and provide the support that they desperately need. Thank you.
Thank you very much. Thank you, Charlotte, for your valuable time. And
you're welcome.
Thanks,
Thank
Lynn.
you.
And I hope people watching this as part of Carers Week, if it's affected you in any way, or any of the information is something raised a question for you, don't hesitate to contact Carers Trust. even if you don't know anyone or don't have long COVID, but you think you may know someone, again, contact us and we can share information with you. Thank you very much.
Thank you.